Morning, it's June 25th. Welcome to the Mayor's Health Table, and we'll start off with opening comments from Mayor Perry.
Good afternoon, everybody that's on the line. Thank you once again for attending this weekly session. We have had 2 new cases, unfortunately, this week. I know we've got Dr. Canton on the line, and I'm expecting there will be a few questions. So I will hand it directly over to Dr. Canton. Thanks very much.
Good morning. Thank you, Mayor Perry. So yes, at this point in time, the Porcupine Health Unit area has now announced 2 new cases over the weekend of COVID-19. So our confirmed positive case count is at 67 with 2 active cases. These individuals, as posted earlier and as per the bulletins over the weekend, are both in stable condition. They are in self-isolation at home. They are following the public health guidance and have continued to do so throughout the process. We thank them again for their cooperation with the follow-up investigation, with their commitment to the measures to prevent the spread to other community members. And so at this point in time, we are still conducting the investigation. But again, I just need to remind everyone that through the identification of positive cases, public health does a thorough investigation with the case themselves. We go through potential exposure risks in the days, up to 14 days, leading to their diagnoses and their positive test result. We do this to determine any potential exposures, any potential risks that may have led to them obtaining the infection itself. Additionally, we go through the symptoms that they may or may not have. We also go through any individuals that may have been exposed to them or around them throughout the time that they may have been infectious. During this time, we not only go through close contacts, but we also look at potential public exposures that may be important to note for others. I need to assure the public that throughout this process and throughout the entire pandemic, public health does a very thorough job of ensuring that any potential exposures that the public or other contacts that have been named or identified need to be aware of are notified. If we are not notifying, it is because we have not found any that need to be discussed or reviewed in a public nature. At this point in time, I need to remind everyone again that if you are waiting to be advised that a positive case has been identified in a public space, it is too late. We need to continue to act as though COVID-19 is circulating, as though COVID-19 exposure and infection is possible and probable still. We need to continue to follow the proven measures of washing our hands diligently and well when out in public, of following and supporting local businesses and workplaces and the measures that they're putting in place to reduce the risk of spread for their staff and for all of us. We need to wash our hands when entering and exiting a premise, when going home, before and after eating, before and after touching your face or applying or removing any non-medical face mask. We need to remember to refrain from touching our face when out in public and when we don't have clean hands. Continue to follow cough and sneeze protocol. Continue to wipe down commonly touched surfaces. And importantly, continue to physically distance from those outside of your immediate household and those outside of your social circle if you have one that's defined. This means, again, maintaining 2 meters from those when out in public, even if outside. When it's challenging or you feel it may be challenging to maintain physically distance, it really is recommended to use a non-surgical, non-medical mask or face covering. We have videos online and information online on how to safely use, apply, remove, and even make non-medical masks so that everyone has access to this important measure to help prevent and help reduce the risk of exposure for all community members. I want to also ask for and remind people at this point in time, as we announce more cases, potentially even moving forward, we need to remember that this has been an extremely challenging time for all, that our communities have demonstrated an immense commitment to the steps required to prevent infection, to reduce the risk for themselves, for each other, and for all. We need to continue to act with compassion and kindness. This is extremely important. The only way we will continue to move forward through this in a positive manner, to continue to see the great results we have seen thus far, is if we work together. Kindness and support are really necessary at all stages of this pandemic. We again remind everyone, if you are concerned that you may have been exposed to COVID-19 or concerned that you may have been in the past, you are able to call and get tested. If you have symptoms, even mild, please call. Please isolate yourself at home. There are resources on how to do this. There are supports to ensure that you're able to do this safely and well. And please call to get tested as well. There are assessment centers across the region that are available for testing, and we will continue to follow up with any individuals that may have been exposed or are concerned that they have COVID-19 to provide the direction necessary. Over the last couple of weeks, we have seen significant changes. We have seen businesses open up. We have seen some nice weather, not so nice weather the last 2 days, but some nice weather, some increased availability of gaining the social contact that we so need from other loved ones and family and friends. And as we move forward, we just need to continue with the commitment. Announcing 2 cases is an important reminder that COVID-19 is not over. It's an important reminder that we need to remain diligent and we need to continue to follow the proven measures that will help reduce the risk of COVID-19 for us all. Thank you. Merci, Miigwech.
Thank you, Dr. Catton. Next, we'll go to the Timmins and District Hospital.
Yes, good afternoon, Mr. Mayor and folks on the phone. I just want to preface my comments today by saying that the cautious reintroduction of visitation at the hospital is being done keeping in mind the safety of patients, staff, physicians, and visitors. So this is a very thoughtful, incremental introduction of visitation. Visitor restrictions have been in place at the Timmins and District Hospital since March 19th under the direction of the Ministry of Health. We know these restrictions have been difficult on patients and their loved ones, but were necessary as we saw the cases of COVID-19 climb across our region. On June 15th, following the recommendation of the Chief Medical Officer of Health, the hospital began planning for the limited resumption of inpatient visitation. Beginning Sunday, June 28th, scheduled inpatient visitation will begin at the Timmins and District Hospital. As part of the phased approach, the following process has been put in place. Patients will be able to receive up to 2 visits per week for up to 1 hour for each visit. Patients may choose up to 2 designated visitors over the age of 16 who will be scheduled for alternating visits. Hospital staff are currently contacting all patients to identify the designated visitors. To ensure the safety of all patients, visitors, staff, and physicians, the hospital will be scheduling all 1-hour visitations in advance and not permitting walk-in visitations at this time. Requiring all visitors to remain in the patient room throughout the visit. Access cafeteria, ward, and other areas of the hospital will not be permitted at this time. Ensuring that there is only 1 visitor scheduled per patient room at a time, and requiring screening to be completed prior to entry to the hospital. No visitation will be permitted for those who have any cold or flu-like symptoms that resemble COVID-19 symptoms. Hospital staff will be calling designated visitors between 10 a.m. and 6 p.m. scheduled visits. We thank you for your patience as we start this process. We are also asking that all scheduled visitors and patients attending the hospital consider bringing their own mask prior to attending the hospital. As we've seen this week with the reporting of 2 additional cases for the Porcupine Health Unit, we aren't out of the woods yet. COVID-19 the hospital is closely monitoring COVID-19, and COVID-19 is circulating at some level within the population. Changes to visitation may be made in order to respond to future COVID-19 changes. As always, please stay safe, wash your hands often, and please be patient with hospital staff. Thank you.
All right, thank you. We'll go to the media for any questions for Dr. Catton or for Blaise McNeil.
Hi, it's Ron from the Daily Press. I have a question for Dr. Catton. It's concerning the 66th case, we understand that this was a fellow who contracted the virus outside of the area. And I'm wondering if, Dr. Catton, if you can tell us where he contracted this virus, and if you can't, then why?
Hello, thank you. So it is part of an ongoing investigation with another health unit. And so at this point in time, out of respect for the entire process and the other communities and organizations involved. It really, we can let everyone know that the individual was not exposed to nor tested in the area. They've not exposed anyone within the area and the public that we are concerned about, and that they continue to follow the public health precautions at this point in time.
All right, so you can't say where the where that other health unit is?
At this point in time, no, we're not sharing that, as that investigation is ongoing. And really, I think the important thing is I know it's always sort of everybody wants to know a lot of the details, but I can just say that this individual has really followed all of the precautions that they have been advised to, and has not done anything to be of any concern for anyone in our region, for others really. Thank you.
Okay, thank you.
All right, any other questions? Okay, hearing none, I'll just check to see if Brian Marks is on the line. Okay, I know Brian was double booked today at lunchtime. He did send some information in the event that he wasn't able to join, so I'll just go through that fairly quickly. So the DSAB is reporting that last night they were able to, working with community agencies, provide 60 meals through the Salvation Army, 74 meals at the McIntyre Arena, and another 54 at the Living Space. In the past 7 days, that's almost 600 meals between community-based agencies, about 484 meals through the McIntyre, and 388 meals at the Living Space location. The food bank yesterday served over 58 families and 21 children. There is some continued growth of use at the food bank, but much of the other meal provision is assisting in this program. And as well, over 209 hampers have been delivered during the month of June through a student nutrition program. More information related to that can be accessed through Brian Marks at the Cochrane DSAB. Right now, we'll go to Steve Logren for an update as well.
Good afternoon, everybody. Shout out to the frontline workers, hospital, first responders for the great job that they continue to do in circumstances around COVID. My message today is not COVID related, but I thought it was an important opportunity to be able to get this message out. I know the media would have saw a news release go out this morning from MRCA related to water levels in the community. So I'll start with Porcupine Lake. So with the rain that we've got, which is, I'm going to say, close to 120 millimeters, the inflows and the level of the lake have risen. The thinking is, with what we have going forward, that we may start seeing those recede slightly today, and hopefully we don't get any rain for the next little bit to be able to watch the lake levels and inflows go down. On the Matagami system, it's a little bit the opposite. We've watched starting yesterday the levels go up. They went up again this morning, and it's projected for the next 24 to 48 hours that they will continue to rise. Again, the Flood Advisory Committee has been meeting on a daily basis. We'll meet again tomorrow, and a lot of what happens in that system, because it is a large system, will depend on the weather that we have coming forward. So again, people who live along the river or have any type of material along the river bank should be thinking about pulling those up and securing them. And from a parent perspective, anybody that's close to some of the creeks and water flows that flow into the Matagami system, water's moving very quickly. So again, urge caution as it relates to that side. Again, thanks very much.
All right, thank you, Chief. An update from the City of Timmins. In addition to the recent announcements related to the reopening of splash pads at the Hollinger and the Whitewater Parks, Effective immediately, the following additional city-owned outdoor recreational amenities are open to the public, subject to the ongoing physical distancing and group size limitations dictated by the province of Ontario. The Gillies Lake Beach will be maintained but not supervised at this point. Public washrooms located at the Hollinger and the Whitewater parks. Open spaces and parks, excluding, of course, playgrounds and play structures, and sporting fields for example, soccer and baseball. However, sports teams can only train or practice with no scrimmages or games being permitted, according to the reopening plans. It's anticipated that the Archie Dillon Sportsplex pool will reopen sometime in late August of this year. As we move ahead with a few capital improvements and then go back through the recertification of the pool and staff recruitment there. Additional facilities and amenities such as arenas and playgrounds will continue to wait for further direction from our provincial government on the opening of those and what phase that may occur. I'll go back to the media if there's any questions, any further questions. All right, hearing none, then we'll go to Mayor Pirie with closing remarks.
Oh, sorry, it's Sergio from CTV. Sorry, I was a little bit late in chiming in there, but I did have a follow-up question to ask about the flood warning, if that's okay.
Go ahead, please, Sergio.
Okay, thank you, Mayor Pirie. So I wanted to ask in relation to the bypasses that the city announced for the lift stations or pumping stations. I feel like some people might not fully understand what that means. So would you be able to clarify what those bypasses are and what they mean for Porcupine Lake?
I'll try to with Public Works, but at the end of the day, there's a series of pump stations around Porcupine Lake that pump sewage to the plant out on Porcupine River. And when you get into high rainfall amounts or quick snow melts, and the rainfall amounts that we've just gone through, it can overwhelm the system. And with that overwhelming of the system, there's a need to pump out into the lake. Again, it's chlorinated, and it's really because of the amount of water that is in the system. And part of that process as well is to be able to report any of that pumping to the Ministry of Environment.
Right. So, okay. So just to clarify, that essentially means that some sewage will have to be sort of bypassed into the lake. Is there any concern for any environmental damage as a result of that?
I would not be able to speak to the environmental damage, but I do know that they do chlorinate, and it's not our first choice to have to do that. Again, it's the design of the system and the capacity that it has, and probably some infiltration and other things that the city has been working on for a number of years to try to mitigate those. But on the environmental piece, I would not be able to speak of.
Okay, so are there any plans for the city right now to investigate any potential damage to the lake and work on sort of cleaning it up after this flood risk is over?
Sergio, it's got to be remembered this is basically a water event. It's not a sewage event, it's a water event. There will be a lot of repercussions as a result of this. One of them will be our engineering department coming back to council and effectively saying those individuals that have the downspouts connected directly to their weeping tiles that discharge into the sewage system, that's got to stop. It overwhelms with water a system that's designed to carry sewage. All of those things will be looked at. We've had a number of incidents with basins being flooded because the sump pumps were overwhelmed. So this basically is a water event, and the idea being, of course, is that rather than have all of this water be discharged or in fact backed up into people's homes, it gets bypassed into the lake. But it's essentially a treated water event when it's like this.
Okay, understood. Yeah, I just wanted to make sure to clarify that and make sure all the details were out there. Thank you.
Any other questions? Okay, and just, I'd like to sum up, Dr. Cannon, if you're still on the line, correct me if anything I'm about to say, there's a couple of assumptions in here as I make my point. But we had 2 new cases this week. One of them was an individual that had traveled, contracted COVID, was tested there, and I think came back to Timmins. His home is Timmins?
Yeah.
Okay. And the second is a 70-year-old, and I'm going to assume that was just a community transmission, picked it up in the community somehow.
That is the assumption at this point in time, yes.
Okay. And the point I'm making is this: as we go into, well, we're well into stage 2, and I presume won't be long before stage, I shouldn't say that, because stage 3 involved bars, but my point is this: we know there's more travel. People are visiting and traveling to different places for any number of reasons. That, of course, increases the opportunity to get the virus and bring it home. Second part, we know it's in the community. As I travel around and I look at the areas that are open, and I think of the amount of work that went in by all the people to make these safe, please, every citizen, be careful when you're out there on the patios. I've taken a look at a few of them. It's nothing better. Get out there and enjoy yourself on a patio. Remember, you've got to be absolutely certain who you're with and trust them. Remember that there's an opportunity, there's more of an opportunity as more people travel to bring it back into the community. And remember, it's still in the community. So please be careful out there. There's been a whole lot of work that's gone out there to get this far, and I endorse it. I want to be where we are. I want to get past this. I want to, and I have no trouble doing business 6 feet apart from anybody, wearing a mask as required, and we can do this. Just remember the risks that are out there, be diligent, and kindly follow all of the advice. We've had a couple of wake-up calls here this week, and it's probably a good thing. This is the last day, official day of school. I think the kids are all out of school now. Effectively, they've been out of school, but I mean, the sessions, the learning sessions are over, the online learning sessions are over. So we're going to see more people out and about in the community in any event. We're headed into summer. It will stop raining at some point. We'll be back into the nicer weather predicted next week. We've had a bit of a wake-up call this week. It's a good wake-up call, and get through this together safely. I know we can do it. It's been probably weeks and weeks and weeks that we've had any kind of update from Timmins Police Service. That tells me that everybody is conscious of the risks out there and taking all the precautions, and there's been no social problem per se. And again, I would, since we're talking about a couple of different things and bringing up the TPS reminds me, magnificent job yesterday, and the individual that was apprehended safely. So my hat's off to them as well, again, in very difficult circumstances. But getting back to what my summation is, we're doing a great job. We've had a bit of a wake-up call, and keep that in your back of your mind when you're out there, whatever you're doing. It's still with us. It's still with us. So be diligent, and thank you very much. We can do this safely together. Thank you.
All right, thank you, Mayor Perry, and once again, thanks to the media for helping us get the news out.